Good evening. My name is Josh Allison, and I'm reporting to you from inside the trigeminal ganglion studio, where we are awaiting information from a touch on the face. First, we have information our human has had discriminative or fine touch on the face somewhere. If it is a kiss on the lips, we will gain information and know specifically where and what the pressure of the kiss is. We also have knowledge that when eating, our human feels tactile touch of the mucous membrane and has proprioceptive information for masticatory and facial muscles. This should help them not bite their cheek or tongue. I am receiving information that our person has just picked their nose and they were able to specifically know where to find the itch that was bothering them, since the trigeminothalamic tract also receives sensory information from the nasal cavity. Now, over to Christian for a look at the travel pathway conditions.
Alright, so first we're going to have a look at the travel pathway conditions, starting with the face for somatosensory sensation touch. Going to the trigeminal ganglion, being the first neuron, traveling then to the spinal cord and the medulla, entering the medulla, crossing over at its second neuron at the main sensory nucleus, traveling up the trigeminal lemniscus through the pons to the brain, entering the VPM in the thalamus, where you will find the third neuron, then going out and sending its receptors to the somatosensory cortex in the inferior lateral portion.
When this pathway is disrupted, it can affect tactile pain and temperature sensations to the face. Now, it all depends on where exactly this injury occurs along the pathway. If it occurs below the thalamus, all sensations will be lost. But if it's above the thalamus, sensations will be there, but unable to localize it. Now, if the injury occurs above the crossing over point, the impairments will occur on the contralateral side of the face. But below the crossing over point, the impairment will occur on the ipsilateral side of the face. If the injury occurs in the somatosensory cortex, the area where the trigeminothalamic pathway synapses, impairments will occur on the contralateral side. Finally, if an injury occurs to the peripheral nerve, the impairments will occur on the ipsilateral side of the face. Over to you, Spencer, with the mechanisms of the injury.
Thank you, Taylor. There are three main causes of injury to the trigeminothalamic pathway. The first is classical trigeminal neuralgia. It is caused by compression of the trigeminal nerve where it enters the brainstem. The compression is usually caused by a blood vessel. The next cause is secondary trigeminal neuralgia. This is caused by a tumor, MS, facial trauma, and/or damages from dental procedures. The third and final cause is idiopathic trigeminal neuralgia. That's all from us tonight. This has been Spencer reporting live from the Trigeminal Ganglion studio, and we thank you for tuning in.